Good morning, everyone. A warm welcome to the third day of our faculty development program on Sustainable Additive Manufacturing in Medical Applications, UN SDG Perspectives. I'm glad to see you all ready for the third day to dive deeper into the topics and the discussions. I hope you had a chance to reflect on yesterday's sessions and are ready for another engaging day. Let's get started and make the most of this valuable opportunity. And I'll request all our participants to please choose your message for the first tone and style of your program. And if you don't forget to express your enthusiasm and appreciation for the participants' engagement. Thank you all. Today we have chief guest Dr. Aditya Mohan Alwala, who is a professor in MNR Dental College and Hospital. He has completed his BDS, Bachelor of Dental Science, from Paninia Dental College. He has also completed his Master of Dental Science from Mamata Dental College. If we talk about the profile of Sir, dedicated and experienced senior maxillofacial surgeon with over 13 years of expertise in performing critical surgical procedures and improving patient outcomes by adding technology to the traditional procedures. Proven track record in leading multidisciplinary teams and conducting research into advanced surgical techniques and patient care. So right now, Sir is working as a professor at MNR Dental College from 2017 to present. He also worked as an assistant professor at Paninia Dental College from 2012 to 2017. He is also having a clinical head at Additive Manufacturing 3D Printing Private Limited Technology from 2013 to present. If we talk about the Sir's research and achievements, he is an author of textbook 3D Printing in Dental Domain, Cambridge Scholarship Publishing, US patent and Indian patent on implantable device for tempo-mandibular joint and method of production. Thereof, he is also managing director at Additive Manufacturing 3D Printing Technologies, Hyderabad, co-principal investigator, research on evaluation of total alloplastic tempo-mandibular joint replacement. He is also clinical coordinator for the study on design and development of customized 3D printing implants. He is a principal investigator in clinical trials and open label multicenter randomized parallel controlled safety and efficacy of tranexamic acid spray 10%. He is also co-investigator in clinical trials, a prospective open laboratory trial to evaluate the efficacy and safety of 3D silk PCL bone grafts. He is also executive committee member, is associate of oral and maxillofacial surgeons of India, Telangana state chapter. So we welcome you, sir, for our third day faculty development program. I request all our participants to give a huge round of applause for our today's chief guest, Dr. Aditya Mohan Alwala. The session is all yours, sir.
Good morning, everyone. At the outset, I would like to thank the Institute Lord's College of Engineering for giving me this opportunity to stand before you and share my knowledge with you. Before I start my presentation, before I jump into my presentation, I would like to tell that the only thing that is constant is change. This was how our operation theaters looked. Where there were lot many people than machines when we started the surgeries. But now the operation theaters are looked like this. There are more number of machines than humans. There are more number of machines than operating surgeons. We also have got the opportunity to work from home. Just like engineers do from work from home, we also started working from home by doing robotic surgeries. So what was the reason for this? The necessity was mother of invention. Whoever are sitting here, all of us would have known this proverb since our childhood. But when I say this again and again, I understand and accept that necessity is the mother of invention. But if necessity is a mother of invention, who is the father of invention? So, but the other question that I want to post is, Do we have to wait till the necessity arises? Why don't we kickstart by creating our own problem and invent it? So all these, the first question that I'll answer at the end of my presentation, but all through my presentation I'll talk about how do we create necessities and start inventing it or applying the technology in the medical field. So with this, I am Dr. Aditya Mohan. I am professor in the Department of Oral and Maxillofacial Surgery, MNR Dental College and Hospital. Dentistry is one such field in medicine where we embrace technologies to the best. All the technologies are being embraced in dentistry more than the medical field. So in the medical field, dentistry is one such branch where we take in technologies and apply technologies. So these are the contents of my presentation. So this gentleman is John Gutenberg. He is the person who invented printing press. Printing was first started by him. He used printing for printing the Bible. It was long back in 1400s. But so many years till 1984, where Charles Hull was the person who started 3D printing in 3D printing. It was in 1984. The technology is called as additive manufacturing. Luckily, I was born in the same year, and my name is Aditya Mohan, AM. It is called additive manufacturing. So I and technology are born together with almost similar names. That's how that's how I got I got influenced with technologies, and this was how the black and white printers used to be there, and we had the black and white radiographs or investigative methods. The investigative methods were like this. We all know these are X-rays. We tend to see all these X-rays. These are all black and white, but the humans are such a kind of greedy people. We don't get satisfied with whatever we have. So, what we did was, this is what we had. We started adding new things to whatever we had. So, we added color to the investigation. Just like we had got a color printer, we got colored investigations. The colored investigations are there, and from there, are we satisfied here yet? We are not satisfied here yet. So we added the third dimension to it. The third dimension is 3D printing. So we all had two-dimensional radiographs. So then we added color to it. Then we added the third dimension to it, and we have a working model in our hand. Are we satisfied here yet? The answer is always no. Where we want to add the fourth dimension, which is called life. Life was being added. This is called bioprinting, but I'm not going to talk much about bioprinting, but I confine my topic to 3D printing. What is 3D printing? Now I don't have, when you have so many technology background people sitting here, I don't have to explain what 3D printing is, but for just our understanding, there are two methods of manufacturing, which is additive manufacturing and subtractive manufacturing. Subtractive manufacturing is the conventional way of manufacturing, and additive manufacturing is the new one, which is called additive manufacturing or 3D printing. Basically, what do we do? This is not new to us. We have carved in rock, which is subtractive manufacturing. We have carved in wood. We have carved everywhere. So, but where is it applied? Where is it applied? We can apply it from pin to plane. 3D printing or additive manufacturing could be applied from pin to plane. It could be as simple as a razor. Morning I get up and I don't have razor in my hand. I print a razor. It could be as complex as this. It could be as complex as a car. This is the first 3D printed car. It could be as complex as this, a 3D printed home. And the application is enormous. We can print jewelry. The conventional way of making jewelry, there are few designs which cannot be made by conventional manufacturing, which could be made with additive manufacturing. So these are the jewelries which are made by CAD designing and printing. We could print on paper like this and get a 3D model. It could be as coarse as this is an ceramic printed models. It could be as smooth as this. These are the lenses. Now the advantage of additive manufacturing is we can have mass customization. See, for example, people who have spectacles here, our eyesight could be 1.5 or the next number could be 2. Maximum we can have 1.75. What if my sight is 1.65? I will have to either adhere to 1.75 or 1.5. But here in additive manufacturing, by the focal length which we could print could be in which could be accurate to few microns, and we can print n number of lenses, 1.6523 up to 10 to the power of 10 micron level. We can accurately print the lenses. These are the lenses printed for customized spectacles or or eye lenses. We can print of different focal lengths. But what is the need of additive manufacturing? It is technology. What is the need in medicine? We all are sitting here, we all are humans. My shirt do not fit somebody else. We see the person sitting next to us is almost the same, but my shirt, my dress do not fit them. There is need for customization because the visual and curvilinear anatomy is very complex in humans, and the physical feel is required for the area of interest. The physical models if we have in our hand, it is a good communication, it adds communication and it educates the patient. The diagnosis and the surgical planning will be very good, and we can rehearse and simulate the surgery before going to the operation theater. We can create customized processes for the patients which fits exactly to them. It is like a tailor-made processes, and we can accurately place implants in the patients by making jigs. So I tell the advantage of 3D printing is of 3 T's. It is useful for teaching, it is useful for training and it is useful for treatment. 3 T's for 3D printing. So some of us sitting here would have broken our hand in our childhood, hand or leg in our childhood. Now we all were bored of this white POP cast on our hand or leg. But now with the advent of 3D printing, we can have the cast of my favorite color. We can have a cast of our favorite color, and this is my hand. I've put it on my own hand and kept it for 3 days. Now the main problem with the plaster of Paris cast is whenever there was a fracture, there is swelling, and the cast was placed at that time, and over a period of time the swelling is reduced, and there is space between between the tissue and the cast. So the aeration is the problem. So to solve this problem, this is what we did a customized hand cast, and we have put it on my own friend who broke his hand, and we can customize to a level. We can print their names on that. We can print their names, we can print any taglines for them, we can have n number of colors to this. And the problem is for children. Children, they do not wear the cast, so I can print patients the child's favorite cartoon on the cast and place it on them. Now I can also change the shape and the size by tightening this. So I can add watch to this, I can add various gadgets to this. So this is how 3D printing can be customized, and it could be used in medical field. It could be used for fixing spines, it could be used for replacing the bones, it could be used for spinal implants. Spinal implants are the first 3D printed implants in the country, where there is this case was tuberculosis of the spine, where part of the spine was removed and it is being replaced with a metal spine. And this is called scoliosis. Scoliosis is lateral bending of the spine. We need to hold the patient's body in straight. So these are the splints which are printed to keep them for longer time. So all this could be printed: ears, nose, fingers, legs and hands. The most important thing is a 3D printed tablet. We have grandparents at home, they tend to take 5 to 10 tablets in a day, and because the number of tablets are more, they tend to forget, and hence the treatment is a problem. So instead of that, they have made a 3D printed tablet, so it is customized to that patient. So morning, afternoon and night they generally take tablets. Morning there are 5 tablets, evening there are 10 tablets. It is customized to one tablet, where that one tablet has got composition of all these 5 or 10 tablets to them, and the name is printed on it with morning, afternoon and night. So a 3D printed tablet will have the composition of all these tablets they need to take, and then it is printed on that. So they feel that they are taking only one tablet, so they will take tablets regularly and they do not get confused. And especially the grandparents who might be illiterates, they do not know to take all the tablets properly. So to make them take the tablets properly, and as the number of days increase, as the number of years increase, because they get bored with number of tablets, they tend to miss 1 or 2 tablets, and hence the health is at stake. Now when we give them only one tablet in the day, like morning, afternoon and night, they will take the tablets properly, and hence the diseases are cured properly. So in dentistry, I belong to dental background. So in dentistry, we can have digital dentures. In one day, we can just take the scan of the patient's mouth, and just like Control P, we print the dentures. So this is how we have printed dentures. Now I am a maxillofacial surgeon. We replace parts missing on the face. So we can replace ears, nose, the bones of the face. So this was the first case of the world where complete lower jaw was being replaced. But what are all the other uses of this? Defining the problem. So that's the tumor there. When you compare with that of left side and the right side, there is a tumor there which is of so much bigger. If we have a printed model in our hand, we can educate the patient and show them this is the problem, which cannot be identified on a two-dimensional radiograph. All these years, we were all using a two-dimensional radiograph or two-dimensional X-ray for a three-dimensional model. Three-dimensional human anatomy, we are using a two-dimensional X-ray, so the accuracy is not possible. But with 3D printing, when we have a three-dimensional model in our hand, the competence is increased and they can have the best treatment option. So this is a CAD design and this is being printed. Such a big tumor of the patient, when we give to the patient, they will see that, they will understand the amount of the problem they had. And we tend to see a lot in the microscopes we tend to see, we do not understand a lot in microscope. So what we did was, we printed the slide in the microscope. Now when we have light against that printed model, we have that complete anatomy seen. The size is about 10 centimeters. The slide what we see under the microscope is few centimeters, few millimeters. Now we have got a 10 centimeter model to this, and the student can feel this. The elevated and embossed or engraved structures can be felt. We can not just print it, we can always feel the anatomy of the tissues what is being printed. So we can convert this virtual model to physical models. And then what I did was, I made a phone case to this, and I can connect to the microscope with the camera focused on the slide what we are looking at. Now when the slide is being shown on the phone, we can point the problem and teach to the students. So we can easily point this, and once it is digital, we can focus it onto the screen, onto the projector, and we can explain. The teaching becomes very easy for them. And this is a case of a patient where the left side the left side there was a fracture. The eyeball, around the eyeball there was a fracture. So we need to support the eyeball from outside. So this is what we did. Ideally we'll have an 5 centimeter by 5 centimeter this is a titanium mesh. We'll have a titanium mesh there. We will have to cut in the operation theater and place this. So, and when we cut, there are sharp ends. We'll have to smoothen the sharp ends and then place it again. Many trial and errors will happen in the theater. But now when we have a 3D printed model, all these trial and errors are made on the model so that the operation theater time is decreased. It is decrease of there is decrease of about 40% of time of the for the operation, and hence the cost of the operation. And this is what we have placed in the patient, and the operation theater the operation time is reduced by 40%. And we all operate on multiple fractured cases. Now the time required for fixing them will be more, and so what we do is in the CAD, in computer, we reduce it or we get back to the proper position, and then we plan the fixation sites. This is how it is being planned to fix, and then we have printed the model. This is the CAD model, this is a printed model. Now we will fix the fractured fragments together, and we will bend the plates to in a proper position so that the bent plates will become guides for fixing the fractures in the theater. So we exactly replicated what was being done on the models and fixed on the patients. So the time required will be very much reduced. That we specify about time because the when the patient is under anesthesia for longer duration, more the time, more are the chances for complications. So less the time, that complications are less, and hence the patients will accept for treating. The next case, there is a big tumor there. When there is a tumor, the tumor grows in 3 dimensions. Initially what we used to do is we used to cut the bone and fix a plate on the patient intraoperatively. But now what happened is we have designed the CAD model. We will cut the tumor on the CAD on the computer and then make it. Now these are all the measurements made on the CAD. Now when there is tumor, there is bulge here, but when we bend a plate like this, the adaptation is a problem, and hence what we do is we cut the other side and mirror image and place it on the tumor side. So we cut the normal side and then place it on the tumor side so that when we adapt the plate, now this is the tumor with bulge, this is the left side of the patient which is a normal bone. So we cut and place it on it so that we can bend the plate properly, so symmetry of the patient is achieved. So it becomes symmetrical. So the plate is being, this is a plate, this is called plate. We bend it pre-operatively so that the adaptation will become the best. So this is one of my best cases of my life. So this is a case of a patient. So this is a face, this is the nose, these are the eyeballs, and the lower jaw is twisted. So this is the midline of the face, this is the midline of the lower jaw. Now when I have the model like this, now this looks asymmetric. So now when we have a model in our hand, this is the midline of the face and this is the midline of the lower jaw. Now this is the treatment. I need to increase the length there. So this is the height on one side, this is the height on one side, this is the height on the other side. Now I have a physical model in my hand and I can plan the surgery very well. So this is the plan now. So I need to cut here and increase now these are the vectors, x and y axis. I'll plan it properly, both horizontal and vertical. and this is how I want to do. This is the plan, and this was the patient. After the surgery, she looked like this. So, so that's the best outcome we can get with the best outcome we can get if our plan is very good. Now the problem is not just this, the child, because she cannot open the mouth, she did not go to school properly because she was all being bullied by her friends in the school because of her irregular face. Now we got her face back, and she had a younger brother. Because she was not able to eat properly, her younger brother was taller than her because she could not eat. So now after the surgery, she became taller than her younger brother. Now she is modeling. This is how she looks. This is a 10-year follow-up of the patient. And this is the journey. From here, she is like this. So we have followed for about 10 years, and the surgery was all, the outcome was very good because the planning was very good because of the 3D printed model in our hand. So this helps in making lives of the patients. This is one more case where the other case I've told, we'll fix plates whenever there is a tumor. So this was a girl where plate was plate. This is called reconstruction plate. For your understanding, it's just a reconstruction plate. And when you see here, there was a fracture. So elsewhere it was done, and after a few years it got fractured. So the patient came to us with this. So this was a fracture. So now this is the problem statement. The plate was overriding on one over the other. So this was the problem. Now there is lot of gap of bone there, and because the lower jaw is 3 dimensional, it is not just a straight bone. There are curves on the bone. So what we did was we printed a model like this, and then we printed a model, removed the plate, and we manufactured a device like this to lengthen the bone. So it is a curved one. Wherever there is curve, we have made curves, and then this is an device which will increase the length of the bone, and then this is a customized device to lengthen the bone. This is the surgery. So we perform surgery, and this is where the bone started growing, and it will reach here. So this, from here the bone started. Now the bone should grow with a plate which should be exactly the same as that of the other side of the jaw. So that is where the 3D printer model will be useful. So in designing this device. So we got this device, and from here, now this is the tooth. Now this will move to the midline. So slowly there is a rail track made from 3D printed model, and it will see the tooth has reached here. So this is the length of the bone that is being formed, and that is been exactly same as that of the plan. So it will have all the curves, and then we have placed implants. This was the planning of the implant, and the implants were placed in the formed bone. This is the bone that is being formed, and then we have placed implants, we have placed teeth. So the patient can chew on both sides properly. So this was possible because of the 3D printed models, and then the beginning and end are all defined, and it is being rail tracked because of the 3D printed model. Similar one where a big tumor was there. So this is a scan. So the tumor ate away the bone. So this is a 3D printed model. Now this was the scan, and now you have a 3D printed model. Even a technical background people can see that there is a problem there. So the patient will understand the problem properly, and then a device was being made because of the 3D printed model, and that's the plan. From here the bone should move to the midline. So from here the bone will move to the midline. So that was the bone formed. Now, as I told, teaching, I am obsessed or I love teaching a lot. So in a private college, the number of patients are always less. Each we can understand the uh, problem. The number of patients are less in private colleges, so the competence of the students will be less. So we cannot compromise on the competence of the students. So what I did was I've printed models and asked them to perform various surgeries on these models so that the competence is increased. So we can simulate anything on the 3D printed model. So I want to do a surgery for tumor, I can simulate a tumor model. I want to do this is the tumor model simulated, and then they learn on this. I want to do a simulate a model for cosmetic surgery, I can make a model and ask them to perform surgeries there. So likewise the competence of the students will be increased. And then tracheostomy is one topic which is very important for saving lives of the student, lives of the patients. So this is a neck, anatomy of the neck. So there are various anatomical structures. So what I did was I have, now these are the list of structures. So what I did was I have designed each anatomical structures like this. This is trachea, this is thyroid, this is, all these are being printed, and this is a CAD assembly. On CAD we have assembled them together and then made a negative replica. With this negative replica, and I've printed all these structures, and this is the negative replica. If I have to teach the anatomy of the neck, I need 3 hours. But if I give these models to the students and ask them to arrange like building blocks, they will learn the anatomy in about 35 to 40 minutes. So they will understand it better. So, and this is the CAD assembly. So this is how 3D printing will help in teaching. So when, and these models are all printed in different densities so that they will, for a skin it feels like a skin, for a trachea it feels like a trachea, depending upon the filling of the printing. Now this is all filled, you could see that the filling is very less. Here the density is different, here the density is different. So they will look like, or they will feel like the natural organs. We can have a lot of digital models, and yesterday Sivaram Krishna sir was talking about his students patent on temporomandibular joint. This is our patent where this is a lower jaw and this is the upper jaw. They both fuse with each other, not allowing the movement. It's a joint, basically it is a joint, a hinge joint where it should move so that the mouth is opened and closed. When they both fix together, we cannot open or close the mouth. This is a normal joint and this is a problematic joint. So we took the scans of the patient and mirror image to the other side, and then we have designed a new joint. We took the replica of the other side of the joint and printed a joint like this. So this will be the joint, and these two are the bony components, and this will be the red ones are the metal components and the white is the plastic component, which will be like a lubricating material in between. So this is a printed joint. This is India's first 3D printed joint, which is being made, and a complete 3D printed joint which is being placed. It was done on September 5th, 2017, and it is being 8 years followed up. The patient is all good. This is a 3-year follow-up of the patient, and she achieved good anatomy, and then she's eating well, and she was married because of the joint. She was not able to open the mouth. So this is a 3-year follow-up of the patient, and the joint is extremely working good. This is a rare disorder where the muscles are soft tissues. You understand muscles, right? Muscles are soft tissues and the bone is the hard tissue. Okay. So now there is a problem called as myositis ossificans, which means due to an injury, the muscle will turn into bone. So a soft muscle should expand and collapse so that there is movement of the organ. But in this, the every injury, the muscle will turn into a bone, and hence preventing the motion of the muscle, movement of the muscle. So this is called myositis ossificans. He came to our OPD with a fight between his own brother, who slapped him on the face, and his muscles of opening and closing the mouth has got this disease and they are stuck, they do not open. So we did about 2 or 3 surgeries, and finally we decided we cannot do smaller surgery, we should be aggressive. So what we did was we removed the whole muscle and replaced the jaw like this, and that made him open the mouth properly. So we have removed complete bone and muscles of all this, so there is no muscle on the right side. Given cases, these are not common, but still, given a case, we can give lot of difference in the lives of the patient. So these are called patient specific implants, where there is conventional manufacturing and additive manufacturing. There are conventional implants or stock implants, and then we have got patient specific implants. So at given conditions where there is no bone in the patients, we cannot have a conventional implant placed. For these patients, we can have a patient specific implants designed for the patient. So these are the patient specific implants which are designed to the patient where there is no bone. I have money, I do not have bone, but I want to eat, I have money. For these cases, we can give the patients best patient specific implants so that they can eat. We can make them eat the patients. These are the cases which I do on a regular basis, about 2 or 3 in a month I do on a regular basis. This is the case where which is being, so these are the steps. This is a case where there was the patient is from Nigeria, where there is a bomb blast and the lower jaw, the lower jaw is hanging down. So a conventional treatment is not possible. So what we did was we have cut the bone like this and replaced the bone from here to here. So this is another tumor. So we can make bones like this. So these are all CAD designed and they fit exactly as that of the natural bone. This is another case of a big tumor here, which is being made like this, a designed model, and this is a printed model which is tested. The fit is being tested for on an FDM model, and then it is fixed in the patient. This is another interesting case where a tooth was being extracted because the patient has got diabetes. We have a sinus here above the teeth. We have a sinus. So the patient is poor and he drank unhealthy water, and there are eggs of an housefly in the water. These eggs went into the maxillary sinus, and then because of the warmth and humidity, they got hatched and they ate off the whole upper jaw. So there is no upper jaw for him, and because it is all hollow, we cannot do a conventional manufacturing. So what we did was we have printed a we took the scan of the intraoral region, and then I printed a denture like this and placed in the patient, and the patient is living for about 5 years or 8 years from now. He's all fine. This is the first case of black fungus that I did. First case of black fungus, it's about in 2017. A complete upper jaw was being lost because of the black fungus, and then there is nothing to take support. So we do not have an option of conventional surgery. So what we did was we made a winged processes like this, and then we designed a process like this, and we have placed exactly as per the plan. This is world's second complete upper jaw replacement, and we have replaced the jaws like this, and this is the outcome what we have. This is a jaw tumor again, replaced with this, and we have placed bone from the hip into this. So what are the problems here what we face? We have replaced a lot. So how do we define the problems in CAD? So these are the pillars of the face, vertical and horizontal pillars of the face. So we need to know what is the problem. This is the defining the problem, where it depends upon where how much is the defect. Now, what are the options which we have are autogenous graft, which means we can take bone from elsewhere in the body. We generally take bone from the hip, we will take bone from the ribs, we can take bone from the leg and replace on the face, which are called autogenous grafts. And then we'll have zygomatic implants, and 3D printed implants are there. So what we do is we need to know whether it is the problem is unilateral or bilateral. We will have whether the pillars are involved or not, teeth present or lost. We tend to see the black fungus, what we have seen in the second wave of COVID. So there are various things. So this patient we have got complete uh, mucosa, which is pink color thing complete, and this patient there is no mucosa. Here they have replaced with the skin. The healing is all different. The tissues what we work was different. So we'll have to design the implant in different ways. Depending upon the problem, we need to design the implant. So it is always a patient specific. Given a different problem, we'll have to do like this. And determining the design, yes, we are making lot of designs, but all these designs whether they are correct or not, we do a finite element analysis and do a cyclic load on these patients. The 500 newtons is the maximum occlusal or the teeth load. When we bite, the biting forces, the maximum is about 500 newtons, and we look for cyclic fatigue resistance. And then on a finite element analysis we do dynamic analysis and then get to know the maximum load of the on the patient, and then we determine if the design is right or not. And then we will see about a, a design is right or whether it fixes properly on the bone on these models, and see whether it is looking good or not, fitting well. So what we have is we did about 50 cases of black fungus, uh, and the average follow-up is about 18 months. Least was about last week I did about one case on black fungus. Highest is of 5 years, and then this is how we have fixed the dentures. So this is about black fungus, which you then generally understand. Now the next level of research what we are doing is metal to milk. All these cases we have replaced with metal, and metal is not the best thing that is possible because the elastic properties of the bone are different from the elastic properties of the metal. So the mechanical properties are different. So there is then there is shear problems. So what we do was we want to shift from metal to milk. Milk is polylactic acid. We want to get PLA resorbable implants. So what we are doing is we collect CT data, we develop models, we do print the implants, and these are the implants which get resorbed over time, which is what we are looking at. So we have tested on rabbit models with PCL, silk, and then PLA, and then we have tested on rabbit models. We performed surgeries, created 4 defects on the head of the rabbit, and then we have placed these different compositions of the structures and looked for the results, and then we have got best results. We are doing human trials now, and probably in next 2 to 3 years we get there for fixing the resorbable implants. Craniomaxillofacial reconstruction, why is it so important? Is it throws unique challenges to the surgeons when we operate, because the facial anatomy is so unique. It is not just the geometric figures, there are curves, there are defects, there are valleys. So it is 3-dimensional configuration of the proposed construct, and from where we ever are taking the bone from, these are all straight bones. So replacement, the place of taking the bone and replacement is all different. So we need to balance between aesthetics and function. Aesthetics means how the look, and function is it should take up the loads. It is so important for facial reconstruction because it is beyond anatomy, it is beyond function, it is beyond aesthetics, because after all it's our face. We need to give the best result to the face as a facial surgeon. So we take help of this 3D printing technology and CAD designing the best, so because we give best to our patients because it's the patient's face. What is the need of this technology is we have been relied on two-dimensional imaging for a three-dimensional object. So virtual surgical planning, CAD, CAM and 3D printing are very exciting technologies for us which will transform the outcome. You have seen the outcomes which are very good. So this will transform the outcomes. It allows surgical team to visualize and manipulate many times before we go to the operation theater. What and where can we get is teamwork and many lectures which are all which will happen like this, where a doctor, a surgeon and the engineers like you will work together. It is possible in CAD labs and maker spaces. The advantages are it is an exact representation of the patient's anatomy. It is a valuable learning opportunity for new surgeons which will increase the competence of the surgeons. So these are lifelike, soft, it can be cut, it can be sutured, it can be operated multiple times. It expands the circle of competence of the surgeons. We can perform n number of trial runs. Till I am perfect with the surgery, patient surgery, I can do n number of trial runs and then go to the surgery. Disadvantage is it is more technical, less of an art. The surgery is always art and science, but it is all art and science, but it now because of the technology it is being more technical. There are no modifications which are possible if there is once we perform the surgeries. It looks very exciting to look at these technologies, but there are limitations for these technologies. The limitations could be classified based upon three things what we do: the CT scan, the 3D model and the rapid prototyping machine. The CT scan, it depends upon the slice thickness. See, for easy to understand, 4 megapixel camera and 100 megapixel camera, the clarity of the capturing of the image is different. So as the number of slices are more, the slice thickness and the slices are more, it captures the more images and hence the image captured will be very clear. And 3D modeler, the conversion of DICOM image to the STL image, STL format, though if the modeler is a freeware and a paid version, it is different, right? So the rapid prototyping machine, the best machine and a better machine. So there will be, these are the limitations. If we use best of all, we get best outcomes. The future, I am looking at a 3D printer in every clinic. A 3D printer should be at every classroom. A 3D printer should replace a black and white printer in every office. Virtual surgical planning, it is when we do it virtually in the computer, it is very easy for the surgeon, safer for the patient, and it gives precise outcomes. How did it start? How, as a medical professional, how did I get into this technology? This was my general presentation in my post graduation in 2010. So this was my presentation in my post graduation. So this is what it shows. So when a passionate postgraduate looks at these images, I fell in love with this technology. So what did I achieve with this technology in these years is I've got name and fame. I've got 29 out of my 66 publications are on 3D printing. I've got 2 companies. I started 2 startups on 3D printing. I've got 2 patents. I'm an author of 1 textbook. I've got 2 DST projects, 2 clinical trials on 3D printing, and a lot of techie friends, and of course money. But the best thing that I've got with 3D printing is thrill. I've got very much thrilled with this technology. To conclude, the impact of 3D printing, or there is a lot of impact of 3D printing in this technology. We always embrace you with open hands for these technologies, and this 3D printing technology has got ability to change the traditional approach of methods of medicine. The society may soon rely upon printing devices to handle difficult medical problems. There is a lot of interest in implementation of 3D printing. Now, how do we do this? Is technology will add an additional hand to the surgeon. And to conclude, medicine and technology, medical colleges and engineering colleges should shake hands with each other to bridge the gap between medicine and technology. Yes, but still there should be a good balance between technology and art. The first question that I want to answer is, yes, necessity is the mother of invention. It is true, but the father is creativity. You should all have creative minds, and knowledge is a midwife who delivers a baby called invention. So we should have all this together so that the outcomes are the best. I hope with this we take a big leap into 3D printing world, and this is what our famous scientist told. No one should die with their teeth in sitting in glass of water, but I tell that no one should die with their jaw sitting in glass of water. I am here to replace any jaw with their whenever there is a problem by using 3D printing. I can replace any amount of jaws. And thanks for your patient listening.